Hello, my name is Amanda Cunningham. I am a school psychologist employed by Midstate Special Education, assigned to serve the Hillsborough School District. In case you do not know what a school psychologist is, we play many roles. School psychologists are prepared to intervene at the individual and system levels and develop, implement, and evaluate programs to promote positive learning environments for youth and to ensure equal access to effective educational and psychological services that promote healthy development. Because of this, I have the privilege of currently collaborating with Hillsborough Area Hospital, the Department of Population Science and Policy at SIU School of Medicine, and the Hillsborough School District on two very unique yet very important programs at Hillsborough High School this school year. I serve as the chair of the David A. Imler Youth Assessment Project Steering Committee. This committee is composed of local community members, including high school students, parents, law enforcement, clergy, mental health professionals, district employees, and medical professionals. These committee members have been working together since February of 2020 to examine student survey results and use that data to guide the decision-making process about what programs will best serve our youth. The work of this group led to the decision that two programs were the best choice. The Sources of Strength program is designed to prevent students from developing mental health difficulties, while the Blues program is designed to intervene once mental health struggles have been identified. They both take a positive approach to addressing mental health and could not complement each other more effectively. Volunteer staff, including teachers, administrators, administrative assistants, counselors, and myself, were trained this past November to begin implementation of the Sources of Strength program at Hillsborough High School. These adult advisors have taken on an added responsibility in a year where their jobs have changed and more is already required of them. It goes without saying that I feel proud and privileged to be a part of this group. They overwhelmingly agreed that even though it is difficult to take on new work during an already challenging time, students need this prevention program now more than ever. Peer leaders were chosen by teacher and peer nomination and also trained because they are the key driving force in this prevention program. The program, based on the idea of upstream prevention, is founded on the goal of promoting wellness, coping, connection, help seeking, and protective factors that result in reduced negative downstream outcomes. In other words, the program emphasizes internal and external resources and employs social networking as support to assist struggling individuals long before they get to the waterfall edge and are really in harm's way. Students and staff alike learn to draw upon the sources of strength in their own lives, as well as establishing new connections and resources to overcome the obstacles they face each and every day. Honestly, don't you all want to be a part of this program after hearing that? If you are not already sold, I might add that Sources of Strength is one of the first suicide prevention programs that uses peer leaders to enhance protective factors associated with reducing suicide at the school population level. And we are the first school in Illinois to begin implementation, despite it already being widely established in the majority of our states nationwide. This is the program that your support from last year's gala made possible, by the way. The Blues program is the intervention component of this project. It is a 6-week group intervention focused on reducing negative cognitions in an effort to prevent the onset and persistence of depression in at-risk high school youth with depressive symptoms. The Blues program is intended to actively engage these students with weekly sessions that focus on building group rapport and increasing participant involvement in pleasant activities, learning and practicing new behavioral strategies, and developing response plans to future life stressors. The program has been shown to lower the risk of major and minor depression for participants, as well as to increase their rates of social adjustment. We are looking forward to the upcoming training of Hillsborough Area Hospital mental health professionals to begin implementation of this program. Your support from this year will fund the Blues program. I hope that you will join us in supporting these efforts. We have identified students at risk. We have identified students in need. We have identified and initiated implementation of 2 programs that can help address these needs. But we need your support to continue implementation and to be able to branch out to other schools and other districts to ensure that we are addressing the mental health needs of our students and preparing them for a successful life with the right coping strategies and strengths in place to meet their goals and to contribute back to our communities. Thank you in advance for supporting this important work as we pioneer community-based suicide prevention in rural Illinois.